Our goal is really direct bedding and get patients back to the bed as quickly as we can. We've got 2 triage areas behind here. So a patient will come in, tell us why we're here, hope we get into triage immediately, and if there's an open bed, bring them right back. If we are full, like over the summer, we'll see the patient, triage them, and then probably have them hang out here in our waiting room and bring them back when we can. We're going to add another 3,000 square feet that will involve the hallway that goes to radiology. They'll take up our triage area and registration. There'll be a family consultation room there, as well as a conference room. And conference space is very tight in this hospital. So this will actually expand. There'll be a pediatric waiting area around the corner there as well. So when we talked about the core, this core is divided into an east and west versus where we were in our other department. There are 33 treatment rooms here, 29 of which have telemetry, and telemetry being where we can keep an eye on your heart rhythm and monitor a little closer on your vital signs. We have 2 resuscitation bays here. We're so tight now, we are bumping into each other. We're having to move equipment out of the way, in and out of the way, to set up for different procedures. For instance, bringing an ultrasound machine in, or if someone needed a special IV or a chest tube or something. It's pretty tight, we can do it, but this is a nice upgrade for us, and I think more comfortable for the patient as well. This room in particular is outfitted with bariatric equipment if we needed to utilize a lift to assist the patient getting on and off the stretcher. And we talked about as time, technology's increased, we've got plenty of room here for storage. We'll have Pyxis or medicine capability to have quick access in both rooms. We have a tight room with just a curtain. There wasn't a room, really not a lot of room for chair space, families, and that's been something as we reached out to the community, had people come in and listen to people, it's so tight I couldn't get my family back. And if you think about it, when you come to an emergency department, you rarely come by yourself. You usually come with an entourage of people, at least 1 or 2, and over the summer sometimes 10 or 15 show up. And it's been difficult for us to accommodate everyone bringing people back, but I think in here we've got chair space for at least 2 people. It's private with glass doors now, we can close that. The mattresses are thicker. That was another comment somebody had made early on, that to try to make these a little more comfortable for people. I think we've done that as well. But this is for dedicated for behavioral health folks. And I think it's a big upgrade from our current department to have to be under that sort of distress and be thrown into that environment. It's not good for anybody. And here we can kind of give them a quiet, isolated spot and bring the resources into them. We're talking about it in East and West Pod. Again, remember how small the space is where all the docs and nurses are working, and now we have ample space for the doctors and mid-levels who are on, or consultants that come in. We're going to bring registration back here. It's really, but the idea is to have the space to flex with the volume, and not only with the volume during each day, but during the season. And that I think is unique to Cape Cod and kind of a vacation destination. The natural light, I think, is spectacular. It just gives you, sometimes when you go in a hospital, it feels like a hospital. This doesn't completely feel like a hospital, which is nice. I think we've lucked out to be able to make our transition before the summer volume gets here, because again, we were almost double, July and August. We really started, schools get out, gets very busy in here. We up-regulate, if you will, with staff, but it's nice to be able to jump into this space when our volume's a little more